My name is Navaz. I'm very, very excited to speak with you guys today about the vagus nerve and the importance of the vagus nerve in healing and health, in optimization, and really becoming the best version of yourself. And I'm going to start with a little bit about me. I am a little bit lighter, but have gained some amazing people in my life. Father of a 2.5-year-old who is sick at home today, which sucks. But, you know, parent life, what do you do? I am a chiropractor by profession. I went to chiropractic college in Toronto, and when I graduated, this was actually the last picture, or the first picture of me and my wife together, one of the last pictures of me at school over there. So this was the day that I found out that I was going to be valedictorian of my class when I graduated in 2010. So that was really exciting. And that's around the same time that we started dating, which was really cool. But when I was graduating, as you can see, I was really not doing well from a health perspective. I weighed 250 pounds. I was dealing with IBS, I was dealing with high blood pressure, I was dealing with A1C levels that were at 6.0, I was dealing with sleep apnea. I was not doing well. And so all of these issues and all of these health challenges were really keeping me back from what I was going to be able to achieve. And what's really cool is I was still able to become valedictorian of my class. So imagine if I was healthy, where could I go from here? And that's what prompted me to say, okay, I need to do something about this. And I knew from my family history that my parents had health challenges, metabolic syndrome and heart disease, and 3 grandparents that passed away from heart disease, and like we all have these family history things. So I said, I don't want to pass this on to my kids. I don't want my daughter, I didn't know at the time I was going to be a daughter, but I don't want my kids to have the same health challenges that I have. I want them to know the tools so that they can address it before it becomes an issue for them, so that they don't have that challenge and so that they can go out and be the best version of themselves. One of my mentors, and it's kind of weird that I'm here today, the building literally behind us here is where the Living Proof Institute is, and that's where I really got my start as a functional medicine practitioner. For 3 years I was working literally in the building next door. And I learned from Sachin Patel, one of the best in the game. And he was the one that introduced me to functional medicine. He's the one that brought me into the fold. And from there I was able to really become the best version of myself and continue to grow and do stuff. I'm very, very happy to say right now that the Anxiety Summit, I don't know if any of you knew that it was on recently, that 100,000 people on it. It's crazy. I was one of the featured guests in the Anxiety Summit event, and I was just found out today my talk was actually voted in the top 5 on that. So you're getting firsthand information of that, and actually probably a lot more than I was even able to give to the lay people on the Anxiety Summit. So why the vagus nerve? Why did I get into this topic? Why did I even choose this to begin with? As a chiropractor, I was very strongly aware of and intimately aware of the idea of neurology, the brain, nerves, how things flow from one point to the other, the importance of communication between cells. And there was always that one nerve, that one thing that stuck out that was a little different from everything else. When it comes to the cranial nerves, we have 12 pairs of cranial nerves. There's only one nerve that stuck out, and that was the vagus nerve. The vagus nerve is the only cranial nerve that passes out of the cranium, out of the head. And it goes to so many different organs. It goes to the heart, the entire airways of larynx, trachea, bronchi. It goes to the esophagus, to the stomach, abdominal blood vessels, even to the carotid bodies in the neck to manage heart and blood pressure stuff. So it goes to the liver and bile duct, it goes to the pancreas, it goes to the small intestine, the entirety of the small intestine, and about 1/3 of the large intestine, followed by other parasympathetic nerves that innervate the rest of the large intestine. How is it that one cranial nerve has such extensive connection? Why is it that this guy is so important? Something I forgot to mention yesterday, and I'm really glad I get to have a redo today, is there are only 3 things that pass from the head down that are connected together, and they're the 3 most important structures in the neck: carotid artery, jugular vein, and the vagus nerve. all together located within the carotid sheath. Those three things, if those are damaged, you have issues with your health. With the carotid artery, blood's not going to get to the brain. With jugular vein, blood's not going to get out of the brain. And with the vagus nerve, you're not going to get signals to all of these organs. That's the importance of it. So it controls throat muscles that send down food to the right, food and air to the right tube. So it makes sure that you don't choke, which is important. It conveys information from all of these organs to the brain, responsible for speech, muscle, and movements. Lowering blood pressure in the case of illness, making sure that your blood pressure levels don't go through the roof. Controlling digestion, responsible for your full feeling, for satiety, which obviously was something that I was not aware of when I was at my absolute max. Causing fainting when overstimulated as well, and that's something we'll talk about when the vagus nerve is not working correctly. What happens then? So, seeing this as a chiropractor, I said, holy crap, like this nerve has something to it. And when I was doing my work as a functional medicine doctor, I always noticed that the issues came up in specific organs. Liver detoxification, gallbladders being removed left, right, and center. Gut issues are at the root of all chronic health conditions, period. Right? We know that heart rate variability, these are things that we can measure that can tell us about our level of health, how well we're really doing. So that connection said, maybe there's something to this. Maybe we need to dig a little bit deeper into the vagus nerve and figure out what it's truly doing and what we can do about it. So what is the vagus nerve truly doing? There are 4 functions of the vagus nerve. The first is afferent information. 80% of the information on the vagus nerve is afferent. Afferent meaning information from the gut to the brain. Essentially, 80% of the information on this nerve is going from all of these organs to the brain. The second function is parasympathetic. This is where we have our autonomic nervous system, the rest and digest specific portion of the autonomic nervous system. So it's really important that we have that 15% of information going down, regulating what's going on in every single one of these organs. 4% of the information on this nerve is motor. This is actually signaling to the muscles of the airway, the throat, the vocal cords, the pharynx and the larynx, all of the muscles at the back of the neck and the back of the face. All of those guys over there, making sure that we don't choke, making sure that we can breathe, making sure that we eat correctly, making sure that we chew correctly, making sure that our airway stays open, because if we don't, we die. And then lastly, 1% of the information on this is from a small portion of skin on the ear. Okay? Very, very important to remember each specific thing, because if we can't get information from the organs to the brain, we don't get the status update of what's going on. We don't know what's truly happening in the liver. We know there's 500 some odd functions in the liver. It's very important to know really what's going on in there. Parasympathetic, we can't regulate that rest and digest. We can't regulate what's truly going on. We can't regulate and make sure that peristalsis is taking place. We can't regulate and make sure that heart rate is being reduced without that parasympathetic function. Motor, like I said, airways, we're going to have issues there. And sensory, we can't feel what's going on in certain areas of the skin. The coolest thing about this is we can use these two, the 4% and the 1%, that 5%, to activate the 95%. This has been proven over and over in the literature and the research, and this is what we're going to talk about today. How can we use this little bit to do more? The other thing that the vagus nerve does is manage the anti-inflammatory pathway, the cholinergic anti-inflammatory pathway. So through the vagus nerve, there's a couple different connections, one of which through the celiac ganglion goes directly to the splenic nerve, to the spleen. And when we're sending the acetylcholine here to the splenic nerve, and the splenic nerve does its job, what it's doing is it's slowing down the inflammatory cytokines, TNF-alpha, IL-1, IL-8, all of those. It's getting them shut down. It's the brakes for the immune system in the spleen. In the gut, it's even more direct. The vagus nerve goes directly to the myenteric plexus, which is the enteric nervous system, to the nerves in the gut. We know we have more nerve connections and nerve endings in the gut than we do in the brain. So that's really important, but what it's doing is it's sending acetylcholine, which is the only neurotransmitter regulated through the vagus nerve, to the myenteric plexus to shut down inflammatory pathways through the macrophages of the intestines. The vagus nerve is obviously important in controlling inflammation levels, and we know that if we have a lot of inflammation, we need something to control that. Inflammation is a good thing in acute scenarios and a bad thing in chronic scenarios. And dysregulated or uncontrolled inflammation is the root cause of a lot of health conditions. So this is really, really important to remember. And because of this, I came to the conclusion that the vagus nerve is the pathway to optimal health. 100% it is the physical pathway to optimal health. And that's why I wrote my book. We have copies sitting over here if you're interested later. But that's exactly why I came to this topic, and that's why I said we need to dig into this. We need to figure out what we can do to optimize the function of this nerve to make sure that people can feel their absolute best. So what could go wrong in Vegas? And I specifically put nerve there because we know a lot could go wrong in the city. But what could go wrong in the vagus nerve? Any ideas what might trigger negative vagus nerve function, dysfunction in the vagus nerve? Yep.
Being stressed and
100%.
Fight or flight.
100%.
Yeah.
Everything that I'm going to go through as being a root cause is stress. But we have to remember that it's not just emotional or psychological stress, it's biochemical stress. It's physical stress. There's so many different stressors that lead to a challenge in there. It's stress. It's putting too much pressure on the vagus nerve to do the job that it needs to do, period. Okay? Yeah?
So do all the different stresses affect it the same?
Depends on each person. This is where the individuality really comes into play. Not everybody is affected the same way by the same stressors. Okay? Number one, biochemical stress, hyperinflammatory diet. This is an easy one. We all know crappy diet, crappy gut, whatever, all those things happen. So we know that if we're causing biochemical stress to occur in our body, we're going to have high levels of inflammation. We're going to have a lot of work for the vagus nerve to have to do. And if we're constantly giving it that negative inflammatory information, we're going to cause more problems for it. And when we have a crappy diet, we know that that's then going to affect the gut. And it's going to lead to dysbiosis. And as we know, the vagus nerve does innervate a large portion of the gut. So that information that's coming from those gut bacteria, parasites, viruses, yeast, that's going up to the brain, it's important to know that if there's dysbiosis, if there's a little bit of imbalance going on there, we're going to have high levels of inflammation. We're going to have issues that the vagus nerve needs to respond to. This is where functional medicine really thrives, is we can test. We don't have to guess what's going on there. So the test that I personally use, that we use in practice, this is Laura, IHN grad, and amazing teammate of mine at Health Upgraded. What we do is we test. We use functional lab testing to identify the root cause of health challenges. So we use the GI map stool test as our primary stool testing kit so that we can make sure that we identify exactly what's going on. You'd be shocked to see what comes out of people when you know what's going on and you know what to do about it. And there's natural tools that are far more effective than pharmaceutical stuff once you know what to do. But we test, we don't guess. That's where we are able to thrive.
Sorry, this is a stool test, you said?
That's a stool test, yes.
A comprehensive stool test?
Yes, absolutely. It is the most comprehensive stool test on the planet.
Is the one that you have to send to United States?
Yeah. It's a really great lab. The lab is called Diagnostic Solutions Laboratory. David Brady is the chief medical officer there. Really great guy. Yeah.
Maybe you're going to go into what the test shows you, but how does that compare to Viome?
Viome is Viome's panel is a lot smaller. It uses some DNA stuff, but it's not as strong. This is a very comprehensive DNA PCR technology profile. And Viome doesn't include a lot of the parasites, worms, and yeast. It's primarily focused on the bacteria, a little bit of virus. So Viome is good, but we don't know a lot about the bacteria. It's estimated that we know about 17% of what's going on in the gut, and we don't know 83%. If we can get everything that's going on, the microbiome, remember, is not just bacteria, it's everything. And that's why I like the GI map test, because it's so broad. Viome's good. It's a great retail type test, right? But at $149, what are you really going to get from it? It's not a bad option though. When we have a lot of these bacteria, parasites, viruses, yeast, hyperinflammatory diet sending in toxins to our body, the next area where we can have challenges is obviously the liver, because toxins go through the portal vein to the liver first to be detoxified, to be cleared out. And if we're constantly throwing toxins at the body, we're constantly stressing the body with biochemical stress, then the liver is going to be backed up. And we know liver detoxification has two important pathways. Phase 1, phase 2. We know that it has to come out in one of three ways: stool, urine, sweat. We know that if any one of those three is backed up, we know that we're going to have a challenge in getting rid of the stuff that needs to get out. And remember, the information that's going on in the liver, those 500 functions, are being relayed up to the brain through the vagus nerve. And the inflammation and the control of what's going on inside there is coming down again through the vagus nerve. So it's very important that this be working well. And this is why poor detoxification, constipation, diarrhea, poor inability to sweat, kidney dysfunction, etc. Inability to sweat is a huge one for a lot of people, right? I can't sweat. Or you're not working out enough, you're not actually getting yourself to pump that fluid out. That can lead to a backup in this whole stuff. The most common thing that I see though, before anything else, is dysfunctional breathing. People don't know how to breathe correctly. It's the biggest problem in our overall health, and it's the simplest one to notice in your patients. Okay? This is a great test I have for everyone. So once we're done taking notes for a moment, I'm going to have you all just take a moment. I want you to sit up in your chair. This is something I do with my patients all the time. Pretty sure I did it with Laura when we first met too. Mm-hmm. And we have one hand on our chest, and one hand on our belly. I just want you to close your eyes. Take a couple of deep breaths. And on your next breath, I want you to notice exactly which hand is moving. Is it your top hand that's moving, or is it your bottom hand that's moving? Very subtle movement. Which hand is moving?
Lower.
If you said top, it's wrong. Top is bad. We're not supposed to breathe through our chest.
What if you start with top and then you end with bottom?
That's interesting. It's probably dysfunctional. There's different patterns of how we breathe. It's different patterns of how we've been conditioned to breathe. Okay? And breathing is something that we are generally conditioned to do. And it's completely subconscious. Nobody says you're breathing wrong, start breathing right. Or you're breathing right, stop breathing right. Breathing is one of those things that we've been conditioned to say that a big belly is bad. So let's stop showing that belly and start breathing through our chest. How many people here have tight traps, neck muscles, upper back? As a chiropractor, I see this constantly. And it's because we're using our accessory breathing muscles to breathe rather than our diaphragm, which is the breathing muscle, period. If we're not using our diaphragm correctly, we're using other accessory muscles. If you're going top first, bottom after, you're probably still dysfunctional. Because we should never be breathing in using these muscles. Movement should be the balloon expansion in your belly. Okay, I'm going to show you a really cool video about this afterwards. Sleep apnea, I was suffering from myself. Sleep apnea is one of those things that is so common and people don't know they have it. And if we're not breathing correctly at night, we are not recovering. We're not getting oxygen to the places we need to. And it's something that can be cured if you do the work to cure it. Just like any other condition, if you do the work, it will get fixed. I was able to do this, and now I sleep. I never had a CPAP, thank God. My mom still does, but we're working on that. I fixed it by using Breathe Right nasal strips to help me open my nose, and I mouth tape at night. Mike Mutzel turned me on to that idea. Wanted to punch him the first night, and after that it made me breathe correctly. And now I cannot breathe through my mouth at night. If I do, I wake up with a completely dry mouth. I notice it. If you wake up with a dry mouth, you're breathing through your mouth at night. If your patients do that, guaranteed, they have dysfunctional breathing. They're breathing through their mouth at night. This is the breathing hole. This is the eating hole. We have a backup if we need it, but this is the breathing hole. This is the eating hole. Yeah.
What about patients or clients that have deviated septum?
Deviated septums and stuff, if it's bad enough, I'm all for that surgery because it is actually going to open the airway. Yeah, I'm all for the surgery if they need it. Absolutely. Okay, that's the one surgery that I'm like, please, go do it. All right. So now that we know what could go wrong and what could affect vagus, because remember, if we're causing dysfunctional breathing and we have sleep apnea, it's usually because of an obstruction that's occurring. It usually is because the muscles of the pharynx and the larynx are collapsing on one another. They're not strong enough to keep the tonicity at night to stay open. They're collapsing. When they collapse, that's when we start to snore, or we have an issue with that obstruction, and we actually stop breathing for a period of time. We go into a hypoxic event. Hypoxic event leads to issues with the brain and so many other challenges down the road as well. And that tonicity in those pharynx and larynx muscles, again, remember, comes from vagus nerve. So now that we know what could go wrong in vagus, how do we know if vagus is working well or not? How do we assess its function? So the step that we have is testing. Again, I'm all about testing, not guessing. So let's figure it out. First one, really easy one to do with your clients, 100%, do it on yourselves just to see what's going on, is the bowel transit time test. These are sesame seeds. I recommend getting the white ones, not the black ones. You won't see them, hopefully. So what I recommend is take a teaspoon or a tablespoon of sesame seeds, toss them into a glass of water, drink the seeds, do not chew them. If you chew them, it won't work. It'll digest. It's the seed shell that we cannot digest that allows us to see the seeds pass through. It's the same idea as corn, but I'm gonna stay grain-free with the test, okay? So what we're then able to do is swallow or drink that water, take a note of the time that you are swallowing those seeds, and this isn't exactly correct, especially that colon, it should not take several days. 16 to 20 hours is optimal. From when you first start to see sesame seeds coming out to when they finish, 16 to 20 hours is optimal. Okay? The range goes from anywhere between 12 hours to about 36 hours. Anything more than that is big time dysfunction. Anything less than that is big time dysfunction. Optimal is 16 to 20 hours. Okay? So that's an easy one to do. Obviously, this isn't the best test. This is not the gold standard to determine if vagus nerve is working correctly, but we know that it's strongly linked to peristalsis. We know that it's strongly linked to movement of food through the gut. We need to make sure that we're assessing bowel transit time before and after. And this is a really easy test. I think it'll cost all of 22 cents for the sesame seeds to purchase. It's very easy to do.
Beets work too, right?
Beets? Yes and no. I'm not a fan of saying red. It's really funny. My daughter actually ate beets in her salad. It was a week or 2 weeks ago. And my wife totally forgot that she had fed her beets. And the next day, she was sitting there and she pooed and came out red. And she yelled, my wife yells, "Come upstairs." Run upstairs. And I see a little bit of red. I'm like, Didn't she eat beets yesterday? I'm not a fan of that. But yes, the color and the timing actually was good. Hers was optimal, thank God. But yes, I'm not a fan of seeing red. Just it oftentimes is bad for triggering people to go into fight or flight. Activate that sympathetic nervous system. The best way to assess your vagus nerve, however, is through the heart. So we know that the vagus nerve sends a parasympathetic innervation to the heart. What that's going to do is it's going to slow down the heart rate. And we know that we have sympathetic nerves that go to the sympathetic ganglia, postganglionic sympathetic nerves that go to the heart to increase heart rate. If a saber-toothed tiger was to walk into this door right now, into the room, we would activate our sympathetic pathway. We would turn off our vagal pathway. Heart rate would rise, and a bunch of other autonomic sympathetic effects would occur. We would not be digesting anything. We would not be worried about digestion and controlling inflammation at the moment. We would be worried about survival. And it's important that we have that response, but we should only really be in this response side 5 to 10% of the time. In reality, about 90% of the time, we should be in parasympathetic recovery, rest, digest mode. Now remember this, because the heart has an intrinsic heart rate. We have the SA and AV nodes in the heart that actually trigger the electrical response within the heart. And that intrinsic heart rate, if we did not have any nerves going to the heart, would be between 100 and 110 beats per minute. Vagus nerve will help to decrease it with the parasympathetic, and sympathetic will increase the heart rate. Okay? It's bright over there.
I'm gonna try to close this.
Yeah, no problem. I'm going to continue if you're okay. So what's really important to remember here is we have an intrinsic rate of heartbeat. Sympathetic is going to speed that up. It's going to cause the heartbeat to become faster, and vagal parasympathetic is going to slow it down. It's going to cause it to relax and become calmer. So heart rate is one thing that can give us some indication of what's going on with vagus nerve activity, autonomic activity, depending on where that heart rate is. But even better than heart rate is heart rate variability. Anybody here know what heart rate variability is? It's one of those things that's really difficult to explain, so I'm going to do my absolute best to get it to you, but stick with me on this. We have two people here, person orange and person green. They both have 5 beats occurring within this amount of time. They have 5 beats occurring, coming down to 32 beats per minute. The average interval between the beats is 650 milliseconds. Okay? The difference here is we're averaging out between 744, 427, 498, 931 versus 630, 675, 645, 650. As you can see, based on heart rate, they're the exact same. The conditions look the same. Yet, the difference in the mean RMSD, don't worry about that. We'll not get into the crazy math stuff here. Essentially, the variation is, the average variation is 313 milliseconds. This isn't a real number, by the way, this is just for exaggeration. But 313 milliseconds versus 31 milliseconds. Which one's healthier? Which one? Green or orange?
Green.
Oh.
Oh.
The answer is orange. Higher heart rate variability is a sign of recovery. It is a sign of resilience. It is a sign of vagus nerve activity.
That
Yep.
variability that you mentioned, is it the same or the equivalent when you are exercising? How fast do you recover? So you are
Exactly.
in the 100%,
100%.
and then you recover, and how
Exactly.
many seconds take you to
Exactly.
Yeah.
Your personal variability will dictate how quickly you recover. This is the tool that athletes use to tell them how hard to go the next day or how hard to go that day. They check in the morning generally. The elite athletes will check their HRV in the morning, and see if their HRV is higher today than it was yesterday, go harder. You've recovered better. This is also a very easy way to see if vagus nerve is working correctly, if you can measure it. It's all about balance between the sympathetic and parasympathetic. And so I'm going to get into what that is. Parasympathetic activity is slow. These nerves provide a signal once in a while. Sympathetic activity is constant. If we're getting constant sympathetic activity, counteracted with a that increases the variability, because you're going to have short distances between some and long distances between some heartbeats. That increases the variability. That's a sign that vagus nerve is signaling as well as the sympathetics. Whereas this constant sympathetic, constant clicking is going to decrease the variability and decrease the change in the time between heartbeats. Does that make sense?
Mm-hmm.
Cool? That's how this works. There is nothing out there for the general public that tells them that sympathetic activity is fast and parasympathetic activity is occasional. That's an important factor here. That's how you understand why high variability is good and why the vagus nerve is then signaling. So like I said, it's all about balance. So how do we measure this? How do we know if somebody has good variability or not? There are multiple tools that are out there. This is where we can use the modern technology that's out there to really help us. Anybody here have an Aura ring?
Heart rate monitor? No.
Aura ring.
Oh, okay.
This is an Aura ring. These are Aura rings, O-U-R-A, Aura ring. These are wonderful tools if your patients are willing to invest in them. Anywhere between 300 and 1,000. 300 is the usual. 1,000 just has a couple of cheesy diamonds in it. I've had this for a year. And I know when it's going to be bad and I know when it's going to be good.
1 year?
I've had this for 1 year. Yeah. So I've been able to track. This tracks my heart rate variability, my readiness, my sleep. It has shown me everything for an entire year. I have a year of stats now because I've had this for a year as to what's going on, what's going well. I can tell you right now, every morning when I wake up, within a few points, what my sleep score, what my readiness score are going to be within a few seconds of waking up now. It's pretty amazing. So I know now, I have an objective measure of how well I've actually slept. I have an objective measure of what's going on for a third of my life, and I wear this constantly. I told my wife now I'm married to my health instead of but I have an objective measure. It also is going to measure steps. It's going to be a great tool to measure a lot of stuff. So it's a really great option.
How does it work exactly?
It's photoplethysmography is what the word is. And so it uses little sensors, you can see inside there. You can take a look if you want. Okay.
Isn't that the same than the newest heart rate monitors for exercise?
Some of them
It has
are
the same
starting to
thing.
do it. They have the same things. There's actually studies showing that it's better to measure in the smaller blood vessels than it is on the bigger blood vessels at the wrist. So fingers tend to have the best measures and the closest sensitivity and specificity to the gold standard for measuring these things. Yeah. So the Aura ring is wonderful because it's a constant. You're wearing it all the time.
So it's sending data all the time, or are you?
It's constantly sending data. You can turn it onto airplane mode so that it's not constantly sending data, but it's constantly collecting data. And then once you put it on the charger, it goes off airplane mode and you can then upload all of your data for the day. Or for
Is
the
it much different than Fitbit, that concept?
Similar idea. Fitbit has some different things that it measures. This is way more in depth.
I've heard negative things about Fitbits too, about wearing them all the time. And
So the EMFs and the
Yeah.
Bluetooth and all of that, I
Yeah.
totally get it. Because you can put this on airplane mode, it's the lowest level of EMF and Bluetooth exposure you're ever gonna get, but you can turn it off completely and not have any exposure to it at all if you want.
But then it doesn't work, because it's not collecting data unless
No, it's
on.
constantly collecting data, but it'll only transmit to your phone when you put it back on the charger. So it's a really great tool for that. Like the option to do that is gigantic. And it also will save battery life. Not that, like I think I charge it once a week, which is pretty spectacular. In fact, I think I need to charge it now. There's other sensors out there. This is the Core Sense HRV sensor from Elite HRV. And this is one that's used by a lot of athletes. Really simple to do. You just plug your finger into it. It's open up over there on like the inside. So you can put your finger in it and put it down on the bottom, and it's going to measure on your phone, and it's going to transmit for a few minutes. To get a really accurate reading, the longer the time, the better. Remember, we're tracking variability over time. So more time, more accuracy.
So it's all heart rate related.
It's heart rate, and this is specifically heart rate variability related. What's really cool about this tool is it's also going to tell you high frequency versus low frequency. So it's going to tell you, are you in a sympathetic state or parasympathetic state, and what your balance is. It's a really, really great tool for morning readiness check-in. This is the one that a lot of athletes will use. Okay, and that one's not bad. The Core Sense tool, I believe, is $150. Something that you can do with clients. It's a really cool idea if you want to work with a high performer. This is a really great idea for them to purchase and use on their own, and they can track it on their phone. It's a completely free app, so pretty cool that way. Or our app is free as well. And then this is HeartMath. Anybody heard of HeartMath? No? HeartMath is a wonderful tool that you can use with meditation, deep breathing exercises, help you get into a state called coherence. And so coherence is when we have heart rate variability, and breath rate synced up together. We're essentially in a state of flow, or in coherence, when we have everything working together. The cool thing about this is it doesn't go to your fingers, it actually goes to your ear, which is really fun. But this is how we can track heart rate variability. We can see what's going on with the heart, with the vagus nerve, if it's working well or not. And we can change that. We can improve heart rate variability. The higher the number, the better. Okay? Where we normally see people, and I know I didn't mention this yesterday, I kind of scared some people off with numbers that I might have given out. Poor is anything below 50. Below 50 milliseconds means your health, or the health of your vagus nerve, is not good. 50 to 60 is we're getting close. 60 plus is healthy. 80 plus is endurance athlete. 100 plus is you're off the charts. It's pretty spectacular. Okay? Does that make sense? So now that we know what those numbers are and what they should be, how do we change them? How do we hack the vagus nerve? How do we really improve those HRV numbers? And this is where you're going to get practical tools to help your clients without having to tell them to take this supplement or eat that food or stop eating gluten. We breathe incorrectly? Let's teach them to breathe correctly. Deep belly breathing is huge, absolutely huge. It's going to make massive changes to them, even in a moment when you're stressed out. Sometimes before I do talks and stuff, I'll take a moment and I'll go and I'll sit. Just close my eyes, get into that calm state, because I'll notice that I'm breathing up here. I want to stop that. I want to get myself into that deep belly breathing. I want to do that test, make sure that I'm diaphragmatically breathing. Meditation is one of those great tools that when we focus on our breath, we're paying attention to it, that mindfulness that we're using will help us get into that calm, deep rest and digest state. So deep breathing and exercise have been shown in the research to be unparalleled. And when we go through all of these tools and when we go through a lot of other things, we'll notice that it all comes down to the breath. The breath is our one strong, amazing doorway into the autonomics. So important that we breathe diaphragmatically that I want to show you this awesome video. So this is sort of like a CT, a moving CT. And what you'll see, this is the front of the body, this is the back of the body. Right here we've got the diaphragm, and here we've got the liver, a part of the colon. These are all the organs underneath the diaphragm. Remember, I said the diaphragm is the breathing muscle. But watch what happens when you breathe correctly. What do you see? What's happening? What's happening down here? Movement.
Yeah.
Movement. We are massaging the organs underneath. We're massaging all of our lower organs, all of our abdominal organs, our gut, our liver, they're getting massaged. We're moving them. And remember, movement is life. And what happens if we're not breathing correctly using our diaphragm? Lack of movement. We're not going to get strong feedback through the vagus nerve to the brain from those abdominal organs. We're not stimulating that life that comes from breathing correctly. This is huge. If there's one thing that you can help your patients do that's going to be an absolute game changer, it's this. 100%. What happens when you jump into a cold lake? What's the first thing that happens to your body when you jump into a cold lake?
It opens up and you breathe.
Contract.
You tense.
Contracts first,
Yeah.
and then it opens up
Yeah.
because you learn how to breathe
Yeah.
under stress conditions. So the next step is cold showers. Ice baths are down the road. Cold showers are an easy trick to help people activate vagus. Why? Okay, now we're teaching them to breathe diaphragmatically when they're conscious of it. How do we add to that? How do we make it more difficult? How do we put them under a little bit more stress, positive stress, in order to improve their conscious ability to control their sympathetic parasympathetic balance? What happens when we get into a cold shower? We constrict first, and then we consciously get ourselves calm. So what if you were to say, for the last 30 seconds of your shower, I want you to turn the water completely cold, let it hit you on the most sensitive part of your body, and breathe through it. And what happens?
I hate it.
First day, 100%. You hate it, you hate it, you hate it. But then it actually grows on you. And you feel better. This is huge as an anti-inflammatory. It'll stimulate the vagus nerve, it'll get that cholinergic anti-inflammatory system working. Cold has been shown to be very, very good. Who here's heard of Wim Hof? Right? If you haven't heard of Wim Hof, look him up. It's amazing.
Yeah.
But he is the ultimate vagus nerve controlling person. Under the greatest stress, going out and climbing Everest in shorts and no shirt and nothing else, he's controlled. He injected himself with poison.
Yeah.
And he was able to control the inflammation. On video, he did this. He was able to control the inflammation so he didn't die. Because he can control his vagus nerve. If you can learn or teach your clients to control their vagus nerve, they're going to do amazing. How many of us feel better when we go on vacation? Who here likes to vacation in cloudy lands? Yeah, really?
I've never been anywhere warm.
Go somewhere warm and
Yeah.
then tell me that you don't like it. I'm trying to plan a trip right now. Where is the sunniest place I can go?
Yeah.
When you go somewhere warm and sunny, you will notice that your vitamin D levels go up. You calm down. Vitamin D is that balance point for inflammation. It manages that Th1, Th2 response. Makes sure that we don't stimulate that constant inflammation. It's going to help hack our HRV. It's been shown in a lot of research, vitamin D that's deficient leads to, or is constantly associated with, autoimmunity. It's constantly associated with lack of inflammatory control, and thus strongly linked to, and it's been linked to directly, HRV levels and vagus nerve function. This is huge. If we can get more sunlight exposure, and we know this, we know that it's the healthiest thing for people. Get more sun, get your vitamin D levels up, activate that vitamin D, because just taking it on its own is not going to change everything. You need to actually activate it in your skin, sunlight exposure will do that. So this is a great tool to do that. We talked about the muscles of the back of the throat and the muscles of the larynx and pharynx. One of the best tools that you can use, it's really easy for people to do, you don't have to go and throw a bunch of cold water on the back of your neck, is to gargle. The muscles of the voice box, muscles around the voice box, the muscles that give me pitch and tonality in my voice are activated by the motor component, that 4% of vagus nerve. How can I challenge that to work hard? Gargling is awesome, because when you're gargling, you have to make sure that you keep an airway open, that you make sure that you don't choke on whatever's coming in, and you're stimulating the muscles. The pharynx muscles, the larynx muscles are all activated at the same time when you gargle. So what I get people to do is keep a glass by their sink for every morning and every evening. You go to brush your teeth, fill up some warm water in your cup, throw a little bit of salt in there for the antibacterial effects, and go and gargle. And you take 3 sips out of that cup, and 1 sip, gargle for 30 seconds as hard as you possibly can. If you just go, oh, you're not really challenging yourself. You really have to go to the point where you start tearing. If you're tearing, you know it's working. This is important to remember. If you're tearing, you know it's working, because it's actually causing muscle feedback to the brainstem that's activating the specific neurons that are activating lacrimal gland for lacrimation. So it's getting not just the vagus nerve, it's just essentially expanding like a light that's just glowing. And when it's glowing, you know vagus nerve is activated when the lacrimal gland is also activated. So that's a great, great sign that they're doing it right. One of my favorite things to do when I'm in a consultation with a client is listen not to what they're saying, but to their voice. Monotone voices are a sign that you don't have good control of your laryngeal muscles. So I don't even need to ask you to breathe, I can just listen to your voice. And if your voice is very steady, and very low, and very monotone, that's a sign that you don't have control of those muscles to improve this. I had a patient who ended up actually, funny enough, she was a friend of mine from before, who ended up coming in because she had ridiculous IBS-D, terrible. She knew the washrooms along her route to work, every single one. She knew where she had to stop if she ever needed to. It was terrible. Ridiculous IBS-D, but the thing I knew about her was that she had a very, very monotone voice. And so we did some testing, and we noticed on her stool test that she was low on her good bacteria, on her lactose, bifidose, a couple of other ones that were a little bit low. She didn't have a lot of bad bacteria. So what could have been triggering this IBS-D? What was causing her to not have good control of her gut? And that monotone voice was the clicking point for me that said, wait, let's do the vagus nerve exercises. She ended up quitting her crappy job, moved to London, England, and ran a marathon recently. No issues with IBS, 0. Like no symptoms. And now she has tone and pitch in her voice, which is nice. If you can give people little tools like this that are going to change their lives, they will be forever grateful, I assure you of that. You can be the best version of yourself. You can give them the opportunity to be the best version of themselves. This was a cool one.
Can this help kids?
100%. Oh,
Like some
100%.
kids have.
You know how much fun I have with a couple of families that I've worked with? I had a 4-year-old that was dealing with constipation issues. And so we said, let's do this as a family. Before you have your meal, you're all going to sit at your table, you're not going to touch your food, and you're going to hum for 2 minutes, the whole family. And you're just going to sit there and you're going to see who can hum the loudest. And the 4-year-old friggin' loved it.
Yeah.
Loved it.
Of course.
And the changes started happening because they were consistent. It's all about consistency. None of this stuff works unless you're consistent. None of it. Even the changes that you're going to recommend to your patients down the road without consistency mean nothing. Consistency is the key. So humming, gargling, chanting, anything to stimulate those voice box muscles with kids is great.
I was gonna ask singing.
Yeah,
Like
singing's
just
huge,
singing in
100%.
general.
Yeah,
Singing
yeah.
out
Oh
loud.
yeah. I tell people if you're commuting and in your own car or if you're carpooling, bust it out. Sing. Go crazy. Go for it.
Yeah.
The more you stimulate that, the better it is. We tend not to use those muscles when we're under stress. What do we tend to do when we're chilled out, when we're relaxed? We sing, we relax, we're calm, we can hum. Om. When I talked about meditation, Om is stimulation of those laryngeal muscles. That's what they were doing with Om. That frequency of Om is the strongest in which you can activate the vagus nerve. Might not be fun for a 4-year-old to do, so that's why I get them to hum, but it's effective. Sleeping on your side has been shown to be the best way for those ideally 8 hours that you're sleeping to be in that right position to activate the nerves, the vagus nerve. HRV levels are higher when you sleep on your side than when you sleep on your back or on your front. And funny enough, left side is better than right. Not significantly, very, very slight, but it's there. It's also better for your posture as a chiropractor. And laughter, social interaction. We know now social isolation is the #1 comorbidity to depression, anxiety, death, period. Like #1 all-cause mortality is social isolation. So if we can be with people, going out, spending time with like-minded individuals, laughing, getting out in those social situations, we're going to be happier. HRV is higher in those who rate themselves as socially able to interact with others than those who say that they're very introverted. Okay, so one of the things you can tell your patients, go out for a coffee with a friend. Think of a friend right now, one friend. I guarantee you're going to think of somebody that you haven't talked to in a long time. Text them. Just meet up for a coffee, tea, whatever. And watch how good you feel at the end of that. It's because you're in parasympathetic optimization state. That's all I have for you guys today.
Thank you.